Now, when I talked about Viagra, I talked about the mechanism of how it works. It prevents something from breaking down. So I looked up alternatives to Viagra, which are basically called PDE5 inhibitors. And I found a series of them that will not only mimic the mechanism, but will also increase nitric oxide, because Viagra does not increase nitric oxide, but these do. The first one that is most researched is called horny goat weed. And I will put a link down below of some research, human research, to show that this has a significant effect of increasing nitric oxide and also improving erectile dysfunction. One of the problems with horny goat weed is it's not very bioavailable. So when you're taking it, your body doesn't absorb as much as maybe you would like it to absorb. How do we increase the bioavailability? It's fat soluble. So you want to consume it with fat or your meal, okay? You can also add that black pepper to increase the absorption as well. The next one is Panax ginseng. This will increase nitric oxide and also decrease the loss of nitric oxide. When they did the studies comparing to a placebo, this showed significant improvements. The next one I'm going to talk about is saffron. Saffron does trigger a mild increase in nitric oxide, but it does some other things as well. It works on the central nervous system, especially on your mood and your neurotransmitters. So if you are slightly depressed or have anxiety, that's probably the one that you might want to focus on. And then we get to ashwagandha. This is an adaptogen. I normally recommend this for the adrenals because it lowers cortisol and it increases testosterone, but it also increases nitric oxide. So as I go through these, you want to kind of just see which one matches your condition. Do you have more stress? Do you have more depression or not? And then you can take whatever you need accordingly. And ashwagandha works really good if someone's going through stress because it increases the tolerance to stress. If you have known arterial problems, let's say you have diabetes or you have a history of heart problems, and you've had it for a long time, you may have fibrosis and plaquing. They can do certain tests, I think ultrasound tests and other tests, to actually visualize plaquing in your penis. If you have that, there is something else that you might want to consider. It's called shock wave therapy. It creates this vibration. You actually apply it to your penis and it actually breaks up scar tissue. So there's some really interesting research on that. But again, you only want to take this if you have the problem that this deals with. So if you don't have fibrosis and you don't have this endothelial issue, then it's not going to really work, but it can stimulate more growth of capillaries and things like that. All right, number one, fix insulin resistance. You need to go on a low-carb diet, cut out the sugars, cut out the starches. Now, what's interesting about insulin resistance is that that develops for 15 to 20 years before you even become a pre-diabetic. So a lot of people consume a lot of sugar. You can't really depend on this test called the A1C. That's a measurement of 3 months of blood sugar. If that insulin is pulling the sugar out as fast as you're eating it, especially in the earlier stages of insulin resistance, it might show normal. One of the best tests to do is a fasting insulin test, okay? That'll really show you the picture of what's going on well before you get prediabetes. So you want your fasting insulin to be below like 7 or even below 5. Mine is at 2. I like to keep it really low. I don't have a lot of sugar in my diet. Number 2, arousal. To trigger erections, there are various things that involve your eyes looking at something, your skin, touch, which by the way is the most powerful stimulus, your mind, and even a scent. When you get aroused, you have these triggers that trigger what's called the parasympathetic nervous system. But it's the parasympathetic that triggers this nitric oxide, okay? So in other words, if you're trying to get an erection and you are under stress, it's just going to shut things down. There's a couple little things that you might want to do to quickly put your body into the parasympathetic mode. Nasal breathing. Breathe out of your nose slowly. It's going to increase more CO2, which is going to increase more oxygen, and it's going to pull you out of the sympathetic and put you into the parasympathetic. Nasal breathing, okay? And making sure your breathing is very even and relaxed. It's going to pull you out of the sympathetic nervous system, and it's going to help you increase nitric oxide. We've already talked about exercise, okay? We talked about intermittent hypoxia training. There's cofactors that you want to make sure that are in your diet. Zinc, not just for increasing testosterone, but also to help with insulin resistance, to help with erectile dysfunction, probably one of the most important minerals. The B vitamins are cofactors, very, very important to actually beef up or increase nitric oxide. Then we have vitamin D, which is very important in increasing nitric oxide, probably more than any other nutrient. Number 6 is not sleeping. When you don't sleep, you're creating stress, and you don't let your body build up the reserve of nitric oxide. For years, I pushed myself to try to get more things done, and I would wake up at 4 o'clock in the morning. It was the worst thing I could have done, especially for my vascular system and my overall health, and nitric oxide. So sleep is super important. In fact, you can do all these things right here, and if your sleep is not good, if you're not sleeping at least 7 to 8 hours, then none of these are going to work. Sleeping in a cooler temperature is going to be very, very important, especially at night, because that cooler temperature will push you into the deeper sleep. Pink noise is probably one of the best things to induce a deep sleep, more than white noise. And then number 7, if you're consuming alcohol, that can nullify your benefits, okay? With testosterone and also erections. Seed oils go into the membranes, into your blood vessels, and they make things very inflamed. So you want to get off the seed oils as well and increase the omega-3 fatty acids from fish oils. Very important. Cod liver oil is one of the best because it gives you vitamin D and vitamin A with the omega-3s. So this is really important, but you might not notice the results right away when you take omega-3. It's more of a long-term game to improve and replace all the seed oils. And of course, if you're smoking, all that smoke goes into your lungs, ends up in your arteries, and really shutting down your nitric oxide. Cold therapy, going to a cold immersion or a cold shower, help push the blood out of that area and create a vasoconstriction. And then there'll be a compensation, a vasodilation right after that to increase circulation in your private parts. And this is another therapy that's been tested and researched, and there's some interesting data behind that. Now, I wanted to add something to this video, very important. What I did is I went through all the credible randomized control studies looking for what has the greatest impact on improving erectile dysfunction, but mainly for lifestyle changes, natural things, nutrition, etc. And some of these interventions I have not talked about, so I'm going to add them right now. There's 8 of them, starting with number 1, intensive lifestyle activities combining exercise, weight loss, and a healthy diet. Number 2, Kegel pelvic exercises. Apparently, that creates a lot of blood flow in the pelvic area, and it helps to trap some of the blood in the venous system. And it's also good for urination dribbling. 40% regained normal erections, 34.5% improved, and 25.5% had no change. 40% regained normal function? That's huge with just an exercise. It doesn't cost anything. Number 3, regular aerobic exercise. That means consistent exercise over a period of time. Number 4, L-arginine plus pycnogenol together. Number 5, Panax red ginseng. And number 6 is niacin. That's vitamin B3. Number 7, treating sleep apnea. And number 8, acupuncture. But before you go, this right here, sleep, is super, super important. And I just want to make sure that you're sleeping at least 8 hours every single night, and you know exactly how to do that. And for that information, I put this video up right here. Watch it right now so you have that information too.